BOS News. Join us as we break down all the latest news surrounding the Ebola epidemic.
And tonight we bring you breaking news surrounding the failure of the first potential Ebola vaccine.
Welcome, I'm Sarah Summers.
And I'm Andy Cooper.
The Ebola virus has taken the world by storm, but the outbreak in 2014 was not the first.
That's right, Sarah. Ebola was first identified in Zaire, now the Dominican Republic of Congo and southern Sudan in 1976.
From 1989 to 2008, cases were reported in monkeys imported to Reston, Virginia from the Philippines, where cases of Ebola were becoming more common in humans.
From the Philippines to Uganda to Texas and Virginia, around 1,903 cases were reported, causing a 58% death rate in infected people.
Ebola was treated by the Center for Disease Control and started to become less prominent by the start of 2009.
That is, until March 25, 2014, when an outbreak was beginning in Guinea, Liberia, and Sierra Leone.
By July, health officials called it the worst Ebola outbreak in history, and the Peace Corps were removing volunteers from West Africa.
On September 30th, Thomas Eric Duncan becomes the first person diagnosed with Ebola in the United States. By October 8th, he passed away.
On October 11th, Nina Pham, a Dallas nurse who cared for Duncan, tested positive for Ebola.
On October 15th, Amber Vinson, another nurse who cared for Duncan, is diagnosed with Ebola, after her controversial flight back to Dallas from Cleveland, Ohio, just 2 days prior.
By October 20th, the Center for Disease Control released new guidelines on how to protect healthcare workers from contracting Ebola, and new skin protective gear was distributed.
By December 15th, over 18,000 cases have been reported since March, with a total of 6,856 corresponding deaths. This outbreak was more widespread than in 1976, but because of new techniques to treat infected people, many lives were saved.
Now on to the breaking news of the failed Ebola vaccine. Joining us to discuss this is Marie Poulkieny, vaccine expert at the World Health Organization and one of the Geneva hospital team members producing this vaccine. Tell us, Marie, what are your feelings surrounding this setback?
This is not a setback, not at all. The trials will continue as planned on January 5th. Our team decided to momentarily suspend the trial to ensure that the pain in the hands and feet were benign and temporary.
Tell us about the apparent side effects in the patients.
We've seen in very few cases a mild fever, joint pain, and swelling of the hands and feet, but the data has looked satisfactory overall. No serious side effects or adverse effects have been observed. I stress that this suspension was not to shut down our operation and start from scratch. This is per usual of most vaccine clinical trials.
Now, it is to my understanding that in the United Kingdom trials, 20 volunteer patients have become immune to the 5 strands of the Ebola virus.
Yes, that is absolutely correct. Our team was ecstatic to discover that in just the first round of trials, 20 people had become fully immune to the 5 strains of the virus. Of course, we had hoped for a similar reaction in more patients, but overall this is very promising for the future of our vaccine.
Finally, with the recent discovery of the first Ebola patient in the United Kingdom, what do you think about the vaccine being distributed worldwide in the near future?
I think that near future is the correct wording here. We have a couple more clinical trials with this vaccine and some variations to work out, such as a few mild side effects, but overall I'm very pleased and I look forward to a new vaccine being distributed to everyone who needs it very soon.
Thank you for joining us and sharing your expertise on this topic, Marie.
Thank you for having me.
In conclusion, BOS News would like to bring you to the CDC guidelines and prevention tips for Ebola.
Wash your hands with soap and warm water or an alcohol-based hand sanitizer. Avoid touching the eyes, nose, and mouth as much as possible.
Remember, Ebola is not transmitted from the air like the flu virus. You must come into contact with bodily fluids of an infected person, such as blood or saliva.
Symptoms include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained bleeding and bruising.
Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola, but the average is from 8 to 10 days.
For more info, visit the CDC's website at cdc.gov or call the Massachusetts branch at 1-617-983-6800.
Thank you for joining us here at BOS News. I'm Andy Cooper.
And I'm Sarah Summers. Stay healthy.
Stay strong.
We are Boston. Good night.